Athletes use altitude training as it improves their outcome performance. This happens because it increases their red blood cell count and hemoglobin, as the amount of oxygen going around the body going to the muscles decreases due to there being less oxygen molecules in the air. This happens as the air is thinner. Athletes train at altitude for a big event or match being held at altitude, but also do because the air is thinner, meaning there are fewer oxygen molecules per volume of air. So therefore muscles don't get the required amount of oxygen. Erythropoietin triggers more red blood cells to aid the muscles' depth of oxygen which is produced from the bone marrow. It also initiates the synthesis of hemoglobin and allows hemoglobin to bind to the oxygen in the red blood cells. Altitude is most dramatic and at a high altitude at 8,000 feet above sea level and is noticeable at about 5,000 feet above sea level. When at sea, our oxygen's partial pressure is high in the alveoli but low in the capillaries. Diffusion then takes place between the alveoli and the capillaries. When this happens, the oxygen levels switch from a high partial pressure in the capillaries and a low partial pressure in the alveoli, which creates a low diffusion gradient. There is a high partial pressure in the capillaries but a low partial pressure of oxygen in the muscles. Diffusion takes place between these two sites, which causes the muscles to have a partial pressure of oxygen and the capillaries a low partial pressure. At altitude, the oxygen is thinner, which means the partial pressure in the lungs and the alveoli is at a medium level. The partial pressure in the capillaries is low, so there is still area for diffusion of oxygen to take place. This happens and creates a very shallow concentration gradient. In the arteries, the partial pressure of oxygen is at a medium level, and in the muscles, the partial pressure is low, which is where the very shallow concentration gradient is in effect, gives a medium partial pressure to the muscles, allowing them to oxygenate. Blood also becomes less saturated the higher you get. As the higher you go, the lower the atmospheric pressure. There are three types of training methods for this. First one being environmental chambers. An environmental chamber replicates different climates of the world. It can control altitude, temperature, and humidity. This would be used to save time instead of going off somewhere with a high altitude. The second training method would be altitude rooms. An altitude room is a room that stimulates different altitude levels. The first one being standard of 0 to 3,500 meters. The next being extreme of 0 to 5,750 meters, and the last one being ultra extreme of 0 to 8,848 meters. The last training method we would use is individual use. This is a mask which reduces the athlete's inhaled oxygen levels when training. This can then be done while running on a treadmill or cycling on a cycling machine. There are also three types of altitude sickness. First one being acute sickness, where you get headaches, vomiting, tiredness, trouble sleeping, and dizziness. The second one being high altitude pulmonary edema. This is where you get a shortness of breath at rest, you cough a lot, weakness or decreased exercise performance, and chest tightness or congestion. The third one being high altitude cerebral edema. This is extreme versions of acute sickness, so is very problematic. When training at altitude, you would feel to struggle more due to the lack of oxygen in the air. Athletes will go to altitude before a race or event, so they are used to the effects it has on them. However, when you go back down to sea levels, the performer is going to have an advantage as the body would have produced more hemoglobin to carry more oxygen when at altitude. For example, when the Mexico Olympics took place, most endurance athletes struggled due to the lack of oxygen, but athletes that live at high altitude, for example, East Africans, didn't have this problem. However, this did not affect sprinters or jumpers due to the fact that during their event they did not have to have an intake of oxygen. If anything, gave them an advantage due to there not being as many particles in the air, so therefore they didn't have as many particles resisting against them when they were running. This was especially useful for long jumpers and triple jumpers due to them when they were jumping they didn't have as much resistance against them, so were able to jump further, and world records were broken and held for around 30 years. Here we have two graphs from the results that we found from our test. The graph on the left here is a graph representing the heart rate at rest for normoxia versus the heart rate at rest for hypoxia. Here we can see in the chart below the mean value for normoxia was 92.5 and the mean value for hypoxia was 100. So therefore the mean difference was around 7.5. We then did a t-test on this and got a p-value of 0.01. This value is under the p-value of 0.05, so then it's statistically significant. It's not on this graph, but we also got the rest. We did the same for the PO2, whereas the mean was -7, as for normoxia it was 98, and for hypoxia the mean was 91, and we did a t-test for this as well and got a p-value of 0, so this was also statistically significant. The bar chart on the right shows us the O2 saturation during exercise for normoxia versus the O2 saturation during exercise for hypoxia. We can here see that the mean for normoxia was around 97 and the mean for hypoxia was around 88, so we had a mean value of -11. This is evidence of less oxygen being intake available. We then did the t-test on this as well and got a p-value of 0.02, which is also below 0.05, so therefore it was statistically significant as well. This shows us that the athletes couldn't work as hard at altitude at the same heart rate levels when at hypoxia.